9 years old, I was sitting in this room, and the doctor tells me, "Okay, go ahead and breathe in, scan. Go ahead and breathe out, scan." It wasn't until 3 weeks later that I realized I was going to receive news that would change my life. I was told that I had a condition, a physical condition that would cause me to have my first heart attack at the age of 20. The doctor told me that my lifespan would be significantly shorter, about the age of 50, and that at that age I would be almost immobile, and I would be at a completely vegetative state. I was born with a condition called pectus excavatum. Pectus excavatum is a simple condition. The breastbone basically just grows inwards towards the chest. And in my case, it was severe enough to have significant repercussions on my life. Now, at the age of 9, after that diagnosis, I received surgery that changed my life. I've become much stronger as a result, and I've grown much more as a person because of it. So, hopefully, throughout the course of the speech, you guys will be able to understand what pectus excavatum is, why it's important to know about, and what are some of the solutions to solve it. Now, as I stated, and the general consensus among the medical community is that pectus excavatum is a condition where the breastbone is sunken into the chest. Because of that name, there are a couple different names of pectus excavatum. It's commonly called funnel chest or sunken chest, and to a degree, it affects quite a few people, about 1 in every 1,000 people. However, it's not severe enough amongst all those thousands of people. A lot of people, most people have a very minor form of it, but it isn't serious enough. Now, when it becomes serious, it can affect the physical abilities of the person, just because the decreased chest capacity decreases your lung capacity, and in my case, it was actually pushing my heart up against my ribs, and it was beating up against my ribs. Now, for other people, it can actually be psychologically debilitating, just because there's a lot of body issues that can come along with it, having a big sunken chest. And if you see it out in someone someone with it who has it significantly pronounced, it's very obvious. And so a lot of children get teased because of it, which is absolutely terrible. And amongst the medical community, there's something called the Haller Index. Now, this is approximately a CT scan, and that's what I was describing beforehand. The CT scan is used to determine how sunken in the chest is at its worst point. And the Haller Index measures the shortest distance here from the sunken in chest to the back of the chest cavity, about your spine. They take that distance and compare it to this distance from the edge of your chest cavity. And the Haller Index of a normal person is around 2.5, which means this line is about 2.5 times longer than this line, which is normal for most people. However, when pectus excavatum is involved, it becomes serious when the Haller Index is at 3.25. And that's usually the point where people decide that surgery is needed, and it's needed to correct it, because there's a lot of terrible things that can go on with it. My Haller Index was 3.6, which can really put into perspective how difficult my life would have been going forward. Because of that, my lungs were pushed off to the side, and they were also pushed down towards my stomach, and my heart was beating up against my lungs. Now, how do you fix this? This seems like something so terrible that's so difficult to fix. And in case it is. In fact, there wasn't even a procedure until 1946 when Mike Ravitch, in his dissertation titled The Operative Treatment of Pectus Excavatum, actually created this procedure. And in it, It involved cutting open a line straight down the chest, above the breastbone, and in it, he would make incisions along the costal cartilage that surrounded the breastbone and surrounded the sternum. He would then remove those pieces of costal cartilage, and he would go for one of the most invasive surgeries for it. Having the actual sternum in place, you would make an incision right along the top, and because the sternum is inverted at that point, you would take it out, flip it over, and sew it back on. At the time, this was groundbreaking because there was no way to solve this. It was extremely difficult for children to live their life, and there was a big improvement in life because of this. But it was extremely invasive and it was extremely painful for the individual. Until Dr. Nuss created his procedure in his dissertation titled Minimally Invasive Surgery for Pectus Excavatum, and this is the procedure that I had. Instead of cutting open straight down the chest of the patient, 2 incisions were made on either side of the chest wall, right along the sides. Then a metal bar about the size of the chest, and that's also why imaging was used, but a metal bar was used a curved metal bar was used to correct it. It was placed inwards and then rotated 180 degrees. And so although it does have quite a few it's still moving bones and cartilage, and it has the ability to break things, it's much less invasive than the Ravitch procedure, and it completely revolutionized how Pectus excavatum was treated. Now, for less severe Pectus excavatum patients, some where it's just purely cosmetic and it can still be obvious, but it still has that psychological repercussion on the patient, there are 2 main ways that it can be treated. The first off is the vacuum bell. And the vacuum bell is a little vacuum pump that gets placed on the chest, and it's used as almost a daily treatment. And it's really used for that cosmetic purpose and not as much for cases where it's limiting physical abilities. And the next one is just having an implant in your chest. And that's probably for the least severe. Now, I hope that you guys can all recognize what Pectus excavatum is now and how it can affect someone's life. And hopefully you know how far the treatment has come along since the 40s. But I want to leave you with this. It doesn't just affect people. It affects the Munchkin cat as well, which is really a terrible shame. So hopefully you can go with this knowledge and know that Pectus excavatum is real and that it can affect both people and cute cats. Thank you.